when we first got the news that my father had cancer, it was a dull moment for the family.
2010, I lost my mom to cancer.
I lost my father from cancer.
Was that cancer is not a death sentence. Cancer can be treated and is treatable.
Between 30 and 40% of cancers are preventable.
130 people get cancer each day, and 100 people die every day from it. In our body, we have billions of cells, and they all have different functions. This is a very complicated process that is under phenomenal control.
And if something goes wrong and that control is lost, and particular cells escape the normal control mechanisms, and they continue to grow, and they may spread, that's what we call cancer.
Those cells together, we would call that a tumor. Specifically, cancer is a malignant tumor, and we call it malignant because not only can it invade into adjacent organs, but unfortunately a cancer can spread to other tissues, and that can be life-threatening.
At the simplest level, cancer cells are cells that have lost the ability to follow normal control that the body gives all the cells.
According to the World Health Organization, cancer is the second cause of death globally, killing more than 10 million people annually. The estimated figure by 2040 reveals that, averagely, 30.2 million people will die yearly if nothing is done. With the changing lifestyle in East Africa, an invisible danger of cancer, heart and even viral diseases are increasing at an alarming rate, reaching epidemic levels.
I think there are a number of factors that could explain this increase. We have a higher life expectancy in the country. Advancing age is a risk factor for cancer. There has been a change of lifestyle over the years in terms of our exposure to a number of risk factors, things like use of tobacco, consumption of alcohol, the kind of diet that we consume, and finally also the element of reduction in physical activities.
We've been able to map out cancer to be as a result of some viruses. For instance, nasopharyngeal cancer, the Epstein-Barr virus has been highly identified as a causative agent. Generally, again, lifestyle changes and lifestyle habits and tendencies can cause cancer. What you eat, what you expose yourself to as you work, okay, what you drink. All these have got the potential of causing cancer, or rather triggering this abnormal growth of cells in one's body.
Back in 2016, the government came up with the Kenya National Cancer Institute under Cancer Prevention and Control Act of 2012. Its mandate is providing leadership oversight and coordinating issues around research. This is the body that advises the Cabinet Secretary of Health on all matters pertaining cancer.
We have come up with a guideline defining the minimum requirements for setting up a cancer management center. So this guideline defines the physical infrastructure elements that are required, the human resource elements, the equipment, and other operational considerations that are required. So that we have developed, and we have actually we have done quite a bit of dissemination. I think we have gone to more than 20 counties with disseminating this guideline.
Currently in Kenya, there are 3 referral hospitals where cancer can be treated. They include Moi Teaching and Referral Hospital, Kenyatta National Hospital, and Kenyatta University Teaching and Referral Hospital. These facilities can provide chemotherapy, radiotherapy, and surgery, which are the main treatment modalities.
In addition to the 3 national referral hospitals, we have upcoming radiotherapy centers in 3 counties, in Mombasa, in Garissa, and in Nakuru. And this is a collaboration between the national government and the various county governments. And essentially, the construction is done for these centers. Currently, what is going on through the support of the ministry is the procurement of the the radiotherapy equipment. So I think our biggest role is to support the counties to make sure that the care that is being provided meets the required standards. So we hope that by the end of 2021, the equipment will have been delivered, will have been commissioned. So hopefully before the end of this year, those centers should be able to treat their first patient therapy.
During our interview with the CEO of National Cancer Institute of Kenya, Dr. Alfred, we inquired about cancer overview in Kenya and the most common types.
We see about more than 47,000 new cases of cancer, and in terms of deaths, about 33,000 deaths. And in terms of the top 5 cancers in the country, breast cancer is the most common cancer, estimated at about 5,900 new cases every year. Then it's followed by cervical cancer, estimated at about 5,200 cases. And then we have cancer of the esophagus, about 4,300 cases. And then we have prostate cancer, slightly over 2,700 cases. And lastly, we have the colorectal cancer, which is slightly over 2,300 cases. So I'd say those are the top 5 common cancer cases. It's also important to note that children are affected by cancer. We see about 3,200 new cases of childhood cancers every year. And the most common cancers among children are leukemias, then we have lymphomas, then we have brain tumors, then we have kidney, and then finally we have cancer of the eye, and in particular retinoblastoma. I think those are the 5 common cases among children.
Cancer is one of the greatest pandemic in Kenya for that case, because even to my own experience or to our own people have encountered in life, because sometimes later, a few days ago, I was in one of the cancer centers and I could see for myself how people are serving in that place or how it is affecting them, and I can say it's not something friendly for our case, because I met another woman by the name, I think Veronica, yeah. So Veronica, was having cancer to do with blood, something to do with blood. So like she has to be added blood before she could be treated. The family has used a lot of resources for that case, using even, because I went ahead and asked Veronica about how they have spent on the medication. And she told me that the family had to sell a piece of land to gather a medication. So I think also the government should bring whereby they can help the patients or the family of the patient even in paying for their medication, apart from their own contribution to it.
In addressing the issue of cancer, I think it's a conversation that we need to have at multiple levels. And I think that the major burden when it comes to cancer for me, I would say, revolves around patient education and healthcare financing. Cancer is that one disease that a single diagnosis is able to wreck the financial ability of a family, once and for all. Cancer hits hard, both on the patient himself, but I think it also hits hard on the close friends and relatives of the patients. To tell from my own experience, I've had the unique experience of sitting on what I call both sides of the table, both as a healthcare practitioner on one side handling a patient, but also about the experience of sitting on the other side with a patient who was my father, who battled nasopharyngeal cancer for three good years. The nasopharynx is that area, connecting the nasal cavity, your nose, going back into the pharynx. So the cancer was diagnosed as stage 2B, which was quite advanced, and he was immediately put on both radiation therapy and chemotherapy. When we first got the news that my father had cancer, it was a dull moment for the family. Actually, I do recall when we were told that he was going for treatment at Moi Teaching and Referral Hospital, we were all hoping that it was just an allergy, because it began presenting as a normal nose bleeding, normal headaches, normal malaise and tiredness. And so when you were told that he was going for treatment at MTRH, all of us hoped that it would just be a normal allergy. But then he was taken ill, admitted for a week for the resection surgery to be done, and when the histopathology was done and the results came out, which was also around 2 months later, we were told it was a cancer. It was a dull moment. So from that moment, I would say things went south for us, because it came with the, psychological implications. It came with the financial implications. It came with so much that we were not able to handle directly.
We know that between 30 and 40% of cancers are preventable, through various mechanisms. Now, one mechanism that I would want to talk about is vaccination. There are cancers that can be prevented through vaccines, and I will mention two of them. Cervical cancer, the second most common cancer in this country. So cervical, there's a vaccine that is administered to, can be administered to both young girls and boys, because it covers against the virus that contributes to cervical cancer, what we call the human papilloma virus. Now, it's important for Kenyans to appreciate that this vaccine is freely available in the government, health facilities. It has been available since October 2019. Now, our greater concern is that the uptake has not been very, encouraging. I think the latest statistics show us that less than half of the girls who should have received this, vaccine are yet to receive this vaccine. So I think it's a call to action, knowing that especially when you integrate vaccines, screening, and treatment, you can actually eliminate cervical cancer. So my first call to action would be for parents, both mothers, fathers, to take their young girls who are aged 10 years to go out for this vaccine, because that may actually save the lives of these girls 10 years or 20 years to come. That will save them from getting cervical. The challenge that has been there is that the availability of the vaccine has also been a challenge, because all these countries are looking for this vaccine. So I think the quantities available, or the programs available right now, is covering girls. As we progress and as we have more uptake among girls, then I think the next discussion for us to have is to talk about boys. The second cancer that is actually preventable through vaccine is liver cancer. And what people don't understand is part of the vaccine that we get that is administered to children, the hepatitis B vaccine, actually in later life protects you against you getting liver cancer. The other ways of preventing cancer is what we call secondary prevention. Now, secondary prevention is where you adopt screening as a strategy, because screening means that you detect presence of the disease when symptoms have not come in. Screening services for cervical cancer are available, even in our public health facilities. If you go to most of our, health centers, sub-county hospitals, they're able to conduct cervical cancer screening. Each of the 47 counties has a mammography machine. Now, mammography machines are used to screen for breast cancer, again, which is our number one, cause of cancer. And yet, very few women are going out there to have, their breasts checked for any presence of disease. Data shows us that in terms of screening for cervical cancer, less than 15% of eligible women have been screened. So the other 85%, they are sitting there and will probably be detected when symptoms have come in.
Cancer treatment actually is very complex. And part of the reason is because cancer is this constellation of over 200 different diseases. They have common characteristics, but they're all very different from each other.
The treatment regime for cancer usually follows a more of a conventional path. So depending on the stage, our treatment modalities or other treatment regime is adopted. So for instance, within the early stages, if it's breast cancer, for instance, we've just identified the lump. If it's still, at the very early stages, we can just give, we can adopt chemotherapy for this patient. So tablets, taken over a period of time to dissolve that tumor as it grows. But then if the tumor has grown to a larger extent, then now we can just go in for surgery to remove the tumor all the same. We have seen the same happening with brain tumors as well, okay? You just go in and remove the tumor. But then at advanced stages, then there is a level of chemotherapy and radiation therapy that are now employed, depending again on the mapping of the cancer. Before a treatment regime is adopted, what we do a mapping, okay, where we do, like diagnostic examinations, which will include most likely imaging, okay? So once we do the imaging, radiation or CT scan or ultrasound, then we can see how the cancer has developed, the extent to which the cancer has developed. Then with that, now we can determine the size, the characteristics of the cancer can also be determined through histopathology. And with that mapping, then we can determine the staging, and then now we'll determine what kind of treatment regime to adopt.
Nimeona marafiki wangu wachache wakipoteza wapendwa wao, lakini kwa upande wa kiuchumi iliwasumbua sana kwa sababu walikuwa wakifanya mchango kila wakati. Watu wao wakipelekwa hospitalini. Ni ugonjwa ikiingia kwa mwili si rahisi mtu kupona kabisa. Ni ugonjwa yenye inabidi tu mtu uvumilie nayo mpaka mwisho.
I would say the effects of COVID-19 in one's body are exacerbated by the state of health of the person. If I am immunosuppressed in any way at the time I'm contacting COVID-19, then definitely I will suffer greater effects from the virus. So COVID-19 attacking a cancer patient, which would be severe and could be detrimental or even fatal to the patient because of the immunosuppression that the patient is already facing at that time.
Each one of us has a role to play in terms of managing the cancer situation in this country. We have an individual responsibility to make a difference, either by our individual actions, that would mean by the lifestyle that we adopt, or by just going out to be screened and get to know our status early and get treatment, or in the sense in the element of supporting or helping a person living with cancer or helping initiatives around cancer.
What I would want to urge not only the government actually, but society as a whole, that we look keenly into our healthcare financing models. The more we have people paying out of pocket to access quality care, the more we are plunging more and more families into poverty. Another level of the conversation would be around human resource for healthcare. We need to strategically train more specialists to handle cancer. It's a sad reality that in a country of over 40 million people, we have less than 10 oncologists, in the country, which is quite sad, and these are highly concentrated in the urban areas. Now that presents a challenge because most of the people suffering cancer actually are in the rural areas, okay? So when you see the people coming to Nairobi for treatment, they have traveled from other counties, Narok, Kajiado, Kisumu, Eldoret, okay? So it's because the facilities in those localities have already been overstretched. So they can only afford to come to Nairobi, hoping that they will get a specialist here. But then at the root of everything, I would say cancer would largely call for a more preventive approach to care, to healthcare. We have created a system, unfortunately, that is more reactive, okay, than proactive in care.
Unlike COVID-19, that has killed less than 3,000 people in 1 year, cancer kills more than 33,000 people per year, boiling down to 100 people dying to cancer on a daily basis. Cervical cancer and breast cancer being on the top of the list. And with that, I urge the female community to be constantly going for breast and cervical cancer checkup, which are available in all the 47 counties across this country. To the rest of the population, I urge you to keep constant check on the kind of foods that you eat and the factors that you expose yourself to. I'm Hussein Robert.